Hey listeners, welcome back to the Deep Dive. It really feels like every day we hear about another emergency, a flood somewhere, an earthquake.
Yeah, it does seem like they're becoming more frequent, or at least more visible.
Exactly. And these events are hitting harder. We all kind of know being prepared is crucial, it's vital, but actually getting prepared.
That's the tricky part. It's a real challenge for a lot of people.
Right. So today we're doing a deep dive into this really fascinating news study out of Israel. It tackled a key question. How do different ways of communicating risk, like for earthquakes, actually affect people's readiness? Our mission today is to unpack this research, look at what it tells us about motivating people to act, and maybe uncover some surprisingly nuanced findings that challenge what we think we know.
Yeah, it definitely throws up some interesting points.
Okay, so let's dig into it. This study really got down to a core question, didn't it? When you're trying to get people ready for a disaster, is it better to, scare them into doing something? Or is it better to empower them?
Precisely. And the way they designed it was quite clever. It was a longitudinal intervention.
Meaning they followed people over time.
Exactly. They used an online sample of adults in Israel, and they split them into three groups. You had your control group, who just got a standard leaflet, basically.
Okay, the baseline.
Right. Then there was a fear appeal group. They watched a video with pretty dramatic images, serious warnings, the next one is not if but when kind of message.
Wow, yeah, intense.
And the third group was the empowerment group. Their video was more upbeat. It featured a mother, a woman, actively showing how she prepares her family, making it feel doable.
Interesting contrast. So what were they measuring?
The main thing was the change in their preparedness index. It's a score based on specific actions people took, like did they put together an emergency kit? Did they figure out an evacuation route? Concrete stuff.
So here's where it gets really interesting, I think. You'd expect one approach to clearly work better, right? But this study found no statistically significant difference over time between the fear group and the empowerment group in terms of preparedness actions.
That's the big curveball, isn't it? It seems so counterintuitive.
Totally. So what's the thinking there? Why might that be?
Well, the researchers looked into this and found something fascinating. A lot of the people in the fear group also said they felt empowered by their video.
Wait, the scary video made them feel empowered. How?
It seems that even though the video used fear, it must have also included enough clear, actionable steps. So while it was scary, it maybe inadvertently gave them a sense of, okay, this is bad, but here's what I can do. It gave them some agency.
So the fear might have grabbed attention, but the actionable steps provided the empowerment, blurring the lines.
Exactly. It suggests the distinction isn't always so black and white. Maybe it's about the combination. Even scary messages need that actionable component.
That really makes you think, doesn't it? About how we communicate risk. But there was another layer you mentioned, something about gender.
Yes, this was quite notable. They found what's called a borderline significant interaction. Basically, women in the empowerment group showed a greater improvement in preparedness compared to the men in that same group.
Interesting. Why would that be?
Well, remember, the empowerment video featured a female protagonist, a mother, taking charge of preparedness.
Right.
The thinking is, since women often handle a lot of the household and family preparedness responsibilities during crises, and sometimes report feeling less prepared initially, that specific, relatable narrative might have resonated more strongly with them. It hit closer to home.
That makes a lot of sense. Representation matters, even in preparedness videos.
So, okay, if the style of the message wasn't the main driver overall, what did predict who was more prepared?
Good question. The study did find some clear predictors, being male, being older, perceiving a higher likelihood of an earthquake actually happening.
And also having a higher sense of preparedness to begin with. Those were significant factors.
What about location? Like living near a fault line?
Interestingly, no. Unlike some other studies globally, just living in a high-risk seismic zone in Israel didn't correlate strongly with being more prepared.
Really?
The researchers suggested maybe a victimization model, living under constant threat, perhaps from the ongoing conflict context there, might lead to a sort of denial or fatalism about adding another potential disaster, like an earthquake, to worry about. It's like a complex psychological dynamic.
Wow. That's, complex. But personal experience did matter.
Yes, prior personal experience with an earthquake did correlate with higher preparedness. That finding lines up with research from other parts of the world. If you've lived through it, you're more likely to prepare for it again.
So bringing this all together, what are the big takeaways for, say, public health officials or anyone trying to communicate about disaster readiness?
Well, I think even with the fuzzy result between fear and empowerment videos directly, the overall lean is still towards positive, empowering messages.
What?
It suggests policymakers should probably move away from relying purely on fear tactics. Instead, focus on approaches that build optimism, that emphasize what individuals and communities can do, fostering agency.
Like focusing on community action, maybe?
Absolutely. Encouraging altruism, social solidarity. We saw some of that during the COVID response, right? People helping neighbors. That kind of community empowerment could be really powerful for disaster prep, too. Give people a sense of control and collective efficacy.
This deep dive really shows, getting people ready for disasters is just so much more complex than simply warning them about the danger.
Definitely.
It highlights how subtle messaging can be, the power of narratives that empower, and how differently messages can land depending on the person. So, for you, our listener, here's something to think about. How can we design risk communication that truly is empowering, that speaks to different people's needs and experiences, and make sure everyone feels like they can actually face the unexpected, no matter how daunting it seems?
That's the critical question moving forward.